I cut your knee like a loaf of bread, first thing I see is that your ACL is torn. Should be a nice kind of band of fibers right here, so it's torn. Yeah, a little bit of injury to the meniscus on the inside part of your knee. It's really hard to tell if this is a true injury or if it just has swelling in it. It's very minor. Could be a real tear, could be nothing. Hard to know without actually putting the scope in there and looking at it and probing it and things like that.
Is it a big tear?
The ACL?
Mm-hmm.
Yeah, it's fully torn. Completely incompetent. You have some bone bruises on the outside of your knee and the inside of your knee. What will happen is your knee will dislocate and bang together and bruise the bone. So that's the pain that you're probably feeling on the outside of your knee.
I think that's been the most inconvenient pain that I've felt.
Yeah.
Outside of, just the stiffness from keeping it elevated for so long, but just the outside and the bone bruise.
Sure. And some sprains on the inside collateral ligament and the outside. So when I stress your knee in this way and you're getting pain over here, it's because you stretched out your lateral collateral ligament, but nothing's torn over that. That's really
Will that heal
really
over
good.
time by itself?
Yeah.
Okay.
Yeah, so the one on the inside, the ACL never heals, okay? So that's the problem. Young, healthy guy, like, got to get motion back as soon as possible. Got to get your quad muscles to start acting normal, all that stuff. Got to start walking normal. The bone bruising will heal, okay? There's nothing we do about that. The only question for you is, what do we do with your ACL and that little kind of abnormality of your meniscus? Best thing to do is rehab you up and then just kind of see how you look. Without question, the majority of people who play your sport with ACL tears, they have to get it rebuilt because they can't go back to cutting, pivoting, exploding, not even close, without an ACL. If you were a cyclist or something in line, well, maybe you could go without it, even though I would tell you that it's rare for those people. Okay. Before we could even do surgery, though, you've got to get motion back. You've got to get the stiffness out of it. You've got to get the muscles moving, because studies have shown that if we reconstruct a ligament without having that first, it gets really stiff, and then there's no good treatment for that. It's a really bad complication to have. So what we do is we do this thing called Pre-Hab, rehab you up, and as soon as that knee is looking like it's okay for surgery, if it fits into your schedule, we rebuild your ACL. So that's kind of what we're looking at, unfortunately.
So I was reading your little pamphlet, arthroscopic, minimum.
Yeah, if it's arthroscopic, what I do is I put some poke holes in your knee and I stick a scope in there. And it's essentially a camera. It looks like it's got a pencil, and the camera's at the tip of it, so I can insert it into the knee and I can look all around the inside of your knee just through poke holes. I blow it up with fluid so I have more room to work in there. So that's what minimally invasive is. Back in the day when you tore your ACL, you get a huge incision in the front.
And that's one thing I was kind of scared of, because I had a kid that I coached a couple years ago. His name was Jack. He tore his ACL, and he has a big right down the middle.
Well, so to do what you get, we have to take your tissue, okay? Because studies show that if we use a cadaver ligament, the re-rupture rate's like 7 times as high. So it's got to be your own tissue. And the 2 ways of doing that: one's your patellar tendon, and actually 3 ways: patellar tendon, quad tendon, or your hamstrings. All the pros get a patellar tendon, all of them, because we've been doing it. Well, it's not necessarily the strongest at times 0, but it seems to hold up better than all the others. We've been doing it a long time. It's reliable. It works. So it just seems to be the graft that does a little bit better. And there's some good studies that actually show that it's outperforming the other tendons. So for a guy like you, I would recommend patellar tendon. And to do that, you do have to make an incision right here to harvest that central slip of this tendon. You also get an incision right here to make a tunnel right there.
And then a little small one?
And that's about this big. Okay, smallish one here, and then this one's about the size of length of my finger. Okay, so that's not because I'm scoping it, that's because I have to actually open up and take that tendon out. And then you have poke hole here, 2 poke holes over here, poke hole up here. If you have a meniscus tear, sometimes I can repair it from the poke holes. Sometimes I have to make a little incision over here to repair it. The best thing for you is when I look at it, if I feel like, oh, I need to make an incision to make this really, really good, then get the incision. So yeah, you get some incisions, doesn't look awesome, but
Yeah.
You got to have this thing done perfectly.